Hello, I'm going to try to connect to my Bluetooth. Can you guys hear me okay? Anyone who's on, just give me a
Hello
yes
there.
or a no. Oh, good, you can hear me. Hello. I see a lot of students on, and it's right now 11 o'clock in San Diego. Welcome everybody to the FNP 590 Health Promotions course. This is more of an administrative lecture. I'm Dr. Donna Stahovich. I'm the Assistant Program Director at United States University for the FNP program. I am going to give you guys an overview of what you will be expecting ahead in the 3P courses. I'm going to mute everyone's microphones right now. Okay, because you guys need to stay muted just because it's so difficult when there's like 100 people on a Zoom. Right now we only have 32, but there are 150 students in this course across all the different sections. So it's a Sunday, you know, I'm sure a lot of you will be watching the recording at home. Anyway, if you do have a question, you can shout it out in the chat, or you can hold it for me to look at it, the chat, and speak it out loud. I'll answer questions throughout. If you really are dying to speak, you can do the little raise your hand feature by going to the participants button. There should be a little icon for you to raise your hand. There should be an icon at the bottom of the screen too. So anyway, if you're new to Zoom, hopefully you're not, but if you're new to Zoom, you can use a little raise your hand feature if you have a question, okay? And remember, if you need to go, don't worry. If you're at work or if you're just having this passively in background, it's all recorded, and and the recording should be available tomorrow. All right, without further ado, welcome to the second half of the program, which is the 3Ps in the clinical courses. When you guys have successfully completed this course, you'll take what's known as the 3Ps. Some of you have transfer credit, so some of the 3Ps won't apply to you. And what do I mean by the 3Ps? You'll hear that term a lot. What I mean is pathophysiology, pharmacology, and physical assessment. It's actually advanced patho, pharm, and physical assessment, but it's easier just to say the 3Ps. The 3Ps are some of the most difficult courses at this school. Advanced pathophysiology, you learn concepts related to microbiology, microchemistry, and a little bit of that, but mostly the physiological concepts behind diseases and recognition of the symptoms of those diseases, the presentation of those diseases, and a little bit about the treatment. You'll learn more about the treatments, at least the pharmacological treatments of the diseases, in advanced pharmacology, which is FNP591. Okay, so you'll take patho, and then you'll take pharm, and then if you successfully pass both of those courses, you'll go on to physical assessment. Physical assessment is a 4-credit course. You only take that one course by itself, and there is an immersion. And I'm going to show you, let's see, where you can navigate to. Let's see. Okay, so let's see, Nursing Caring Corner. If you navigate to immersion information on the left-hand side of the screen, again, I'm in the Nursing Caring Corner. I clicked Content, and there's an update here. So that's where you find immersion information. Now, before you get to immersion, I mentioned the pathophysiology and the pharmacology being some of the most difficult courses at the school. And that is true. And I wanted to let you know something else very important to think about. So you take patho, and then you take pharm, and then you take physical assessment. I'm sure all of you have heard on the Facebook page or on social media from your different groups with your different classmates that there are these proctored exams. You may or may not have heard the news that we did remove the HESI, the HESI exams from pathophysiology and pharmacology. Right now, there's only one proctored exam, and that's in MSN 572 physical assessment, that big 4-credit course that you come to immersion. There is a big final exam, and it's cumulative, and it's during 572 currently in week 7 going into week 8. So that means that it will cover patho, farm, and physical assessment. It's a very common tool that many FNP programs use to give a 3P cumulative exam to determine student readiness to enter clinicals. Essentially, being able to master basic competency in those areas, patho-pharm and physical assessment, means that you're ready for the challenge of clinicals, okay? Why I tell you this ahead of time is because if you don't know this information that, wow, I'm gonna have a huge cumulative exam in my health assessment course, my physical assessment on stuff that I learned way back 2 courses ago in patho, you might think, oh, I'm just gonna learn all this information, I'm going to take the test, I'm gonna memorize it, and I'm gonna knowledge dump it. You can't dump it, right? You gotta keep it. And how are you gonna do that? What is your strategy gonna be? I think one good strategy is that every week in the future courses, let's say you did well in patho, then you go into farm. In week 1 of farm, make it a point to set on your calendar to do 15 to 30 minutes of review for everything that you learned in patho that is having to do with the pharmacology concept, so that you're reviewing everything. Then when you get to the 572 course, every single week, you'll need to set aside some time to review both patho and pharmacology concepts, so that when you get to that big cumulative test in week 7, it's not a huge shock, okay? Because you can't just be responsible for those physical assessment concepts, because the test will go way back to patho and farm. There will be a minimum score that you have to achieve in order to go on to clinicals without remediation. Okay, I don't want to tell you what the minimum score is right now, because we may change it, because this is a newer exam. Okay, so for this semester, it might be 55, next semester might be 60. We want to see how our students do. We're not aiming to fail anyone, and please don't see it as if you don't pass this test, you don't get to go on to the clinical. That is not what I said. What I said there will be an opportunity to remediate if you don't meet the minimum passing score. It will be mandatory remediation, because we don't want students going into clinical without the tools and the knowledge that you need to succeed. Okay, so just keep that in mind, that there will be this big cumulative exam. Make sure you develop good study habits. And then right now, since I've talked so darn long, I'm going to see if anyone has any questions. So I'm going to take a moment to pause. I'm going to mute myself. And if you have a question about the 3P courses, go ahead and unmute your microphone and ask. I'm going to start that. So yeah, so there's 570 patho, 571 farm, and 572 physical assessment. During the 572, you'll take a cumulative test that covers the material from all 3 classes. And some people are like, well, that doesn't sound fair, right? Actually, it's actually pretty common at most NP schools that aren't accelerated. Remember, we're an accelerated program. We're not a traditional school. Most traditional schools have students take 2 of those courses, sometimes all 3 in the same semester. So it's not a crazy thing at all. And a lot of schools do use this 3P exam. The one we use is by APEA, Advanced Practice Educational Associates, and it's the 3P exam. And it is not considered cheating if you want to go to APEA and purchase their quiz banks to help you study for that test. Though, as long as you aren't open book or looking at your resources or looking at things up online or talking to people during your test, as long as you are doing your test from your own knowledge and memory, there's no concern of cheating if you decide to buy APEA's quiz bank. Okay. Study guides to help with comprehensive cumulative exams. Well, we receive a study guide. Now we don't really have a study guide for that huge 3P exam. Some of the professors do have study guides for their own tests, but it's not as common to have study guides in graduate education. It's really just not. If you think about it like this, the board exam, right? The board exam that you'll take once you're finished with this school, like 155 questions, there's so much to learn that there's actual review courses, huge books to take. So for this 3P exam, the best thing to do is to look at your notes and look at your study guides from each specific course. So that way you master each course, you should be able to do well on the test. But there is no specific study guide. All right, let's see. All right, I think I got all the questions in the chat. So you can, the resource, well, there's many resources. I don't want to endorse one or the other because I don't want to make sure, I want to make sure you know that USU isn't receiving any financial compensation, but there's many. There's like Fitzgerald study guides, there's LEAP, there's APEA, there's Sarah Michelle, there's a dozen or so FNP study guides. Elsevier also has a 3P study guide, but APEA is the one that the test is based off. So I would think that APA would be your go-to resource. All right, I've got to spend some time talking about clinicals. That's actually the much bigger picture. So I'm going to try to find a website to show you. And then I'm going to screen share, just 1 second. All right, screen sharing my desktop. All right, and so where I'm going to find some really valuable information is simply the United States University website. You see I'm navigating to students and I'm navigating to Office of Field Experience because I want you to see where I'm getting this information so that you know where to get the right information. And then the most important piece of information on this website is the Family Nurse Practitioner Clinical Handbook. I used to give this lecture during advanced health assessment because it was one course before you began clinicals. But what students were saying to me and to the faculty was that it's too late. You needed the information earlier. And we do give you the information earlier because this is on our website, but not many of you, navigate to this and look at this ahead of time. So we want to tell you how important this is. So you see, I went to the Office Family Nurse Practitioner Clinical Handbook. Now I'm going to the Office of Field Experience, and you can read all these different sections about clinical placement, clinical hour requirements, project concert, travel to clinical sites. See, it's just chock full of really, really good information. Now the website has a few flaws. One of them I noticed, if you click on something, it looks like it's blank. You just have to scroll down. It talks about why you have to have OFE approval. It talks about expectations, and it talks about a preceptor database. Very, very important for me to tell you, you must start networking for preceptors now, okay? You need to network. OFE does help. It's a partnership, okay? It really is a partnership. It's not them doing everything. It's not you doing everything. It's you working with someone called your CPC, which stands for Clinical Placement Coordinator, on trying to secure both a preceptor and a site, and both have to be approved in writing in order for you to begin clinical. So the first thing you want to do is look overall at what the program requirements are. Right now, students in this program need 540 clinical hours to graduate. 540 hours is broken down beautifully and evenly between 4 clinical courses, each clinical course requiring 135 clinical hours. If you divide an 8-week course divided by 135, it turns out to be around 17 hours per week. Most students in the second half of this program will do alternating weeks, where 1 week they'll do 2 shifts and the other week they'll do 3 shifts. So they'll do 2 shifts, 8-hour shifts, so 16 hours. The next week they'll do 24. They go back and forth between that. Some students front load it a little bit more than others. So, you can't necessarily backload because there's rules that say that you have to begin a clinical course by the first week, by the end of the first week, so that you can participate in the class. Because you have to participate in discussions about clinical. You have to complete clinical logs. You have to write SOAP notes on your patient. So you can't just say, well, I'm not going to start clinical until week 4 of my 8-week course. That doesn't fly. You have to be able to start clinical within week 1, okay? You may not more than 12 clinical hours in a day. So people who are doing ER and urgent care, as much as you'd like to double up and do a double shift and stay for 18 hours or more, you have only, we're only allowing you to do 12 hours of clinical in a day. You may not be paid by the clinical site or the preceptor. You may pay your preceptor to precept you, but you may not be paid by the site or the preceptor. And if you are working at the same place that you do clinical, like as if you're an RN at this place and you're doing clinical, you have to disclose this in writing to your clinical placement coordinator and their course clinical instructor. You may also not do clinicals with a preceptor who's a spouse, a domestic partner, or first degree relative unless you have written permission from the program director. Okay. And these things are here to protect you and the school. A lot of students like to network with their place of employment to do clinical hours. I don't recommend it. I don't recommend it. I was a nurse for 10 years before I was an NP for 10 years. And if I were to do clinicals at my RN place back when I was an RN, I know for a fact that they would take advantage of me. They would know that I'm an employee there. They would know that I'm able to start IVs and do vital signs and do nursing things. And they would ask me to do that. I'm sure they would have. Okay, so often students are not looked or respected as much as a primary care provider, advanced practice practitioner, if they're doing clinicals at their place of work. So if you do have that as your plan, I would try to consider networking and finding something else. And keep in mind that you must disclose that to your coordinator. If you don't disclose it and you're caught, you could be in violation of the code of conduct. You could be forced to stop clinicals and you could be removed from the course, okay? Documenting hours. So you need to get 540 hours. Every time you go to a clinical, you have 48 hours to document that in Project Concert. That more training on that will come later in the program. So I don't want to get too much into that. You do need to get 135 hours per course, and you cannot roll over hours, but you can bank them. And there is a big difference. So let me try to explain that. Banking hours in journals is when they go into your huge stockpile. So let's pretend the minimum, which is 135 hours. Let's say you did 185 hours. That's 50 more than what's required. That 50 isn't erased, it stays in your bank. So when you graduate, you would at least have 135 times 4 is 540 plus an extra 50. So you'd have 590 hours. It will give you more bragging rights on your resume. It'll be a talking point. You know, I did extra hours more than my program required in an interview, right? More hours is always a good thing. But what you can't do, you can bank them, but you can't roll them over. So if you did 185 hours in your first clinical course thinking, oh, you know what, I did a 50 hours extra because I want to apply those 50 to my next course so I can go to Cancun for spring break, or so I can go to a wedding, or because I'm having a baby. Some of these reasons are extremely altruistic. And I love that the students are proactive and that you want to get these hours rolled over, but it's not allowable. And this is something that's related to big academia and our accreditors. If we as a university, as an institution, are giving a student credit, 3 credits for a 3-credit course, that means we are giving you credit for doing 45 times 3. 45 hours is 1 credit equivalent. And so we have to say that you're doing the 3 credits. We can't say, oh yeah, but they did extra time back then, so we're going to count it towards this course, because that's not the way an accreditor works. We have to withhold our policies. So you'll be happy to know you can bank the hours. You can bank the cases, which is even better. So let's say you did extra pediatric cases. Those cases that you did extra, they stay in your bank. So we do have a current requirement of 80 pediatric cases. And if you did extra peds cases, they don't go away. They will count. You just can't roll over. So you see the difference? No rolling over, but yes, banking is good to go. All right. So let's keep going. So you need a minimum of 135 hours in family practice / primary care by the end of the program. I'm going to stop sharing my screen because I want to drive a point home about this family practice issue. Many students have reached out and said, hey, I see urgent care patients, and you know, like 4 out of 5 of my urgent care come for primary care reasons. Or they say, you know, I'm in the ER and I see like 3 out of 10 of my people are really there for what's kind of primary care. And I stop and I look at them. Well, what do you mean you see primary care in the ER? Well, I have a patient with diabetes that came in and they need a refill on their metformin. Or I have a patient with COPD and I had to give them an asthma medicine. That should have been a primary care provider thing, right? Not an, but an inhaler. And I think about that. I'm like, I have to educate students sometimes. There is a big difference between going to a care place, a caregiver, and getting your needs met for primary care, but actually taking care of their primary care needs is totally different. If you are in the ER and you are seeing that diabetic patient, do you think you're really responsible for making sure that diabetic patient has their annual ophthalmologic examination for diabetic retinopathy? Are you, as the urgent care provider, responsible for following up and make sure they have their annual podiatry exam? If you have that COPD exam, are you responsible for making sure they have spirometry and making sure they have their baseline tests done? No, you're there to make sure they're safe and that their need for that visit has been met. If you're in an urgent care, yes, people will see you because they don't have a primary care provider and they'll come to you for primary care type needs. But you in urgent care and in ER aren't responsible for making sure that me, my 40-something-year-old self has my mammogram done. You're not responsible for making sure I get my colonoscopy. You're not responsible for making sure my child has had their tetanus vaccine, has had their polio vaccine, has had their yearly influenza, okay? Those are primary care activities. And you're not going to get credit for primary care rotation in an urgent care or an ER, okay? So you will be responsible for making sure you get one clinical rotation minimum in a primary care setting, okay? Preferably family practice, but it can be primary care internal medicine or primary care peds. Now, internal medicine, if you are a brand new or newish nurse, only been a nurse for a few years, you might be confused about what internal medicine is and what an internist is versus an intensivist, okay? And versus a hospitalist, okay? No one in this program, no one at all may do inpatient care. So you can't rotate with a hospitalist. You may not rotate with a hospitalist nurse practitioner. Our program only trains you for primary care. Our curriculum addresses primary care activities. We don't teach you IV drips. We don't teach you how to manage acute chest pain, acute coronary syndrome. We don't teach you how to manage a patient on a ventilator. It's not in our curriculum because we're a family nurse practitioner program. So you can't do inpatient rotations whatsoever. We also do not allow subacute care, like a patient that's in between going from acute to subacute and then a SNF. We don't allow that. You may do 40 hours in a SNF or in Alzheimer's care or memory care, but you can't do a full rotation in subacute care, rehab, SNF, not a full rotation, okay? And no inpatient and no trauma centers. Again, we don't train you for trauma centers. You may do 60 hours ER. Okay, 60 hours in this program may be done in the emergency room. Urgent care doesn't have a strict limit, but you do have to get the primary care. So if you're in an urgent care, you could look at it as the max is 100 or a max is 3 rotations because you have to have at least one in primary care, but you also have to get some peds. And a lot of urgent care centers don't see little peds because we have cases for those too. So what I think is best for you to plan is to make sure you do 2 rotations in primary care. If this was me, if it were me, 2 rotations in primary care, I would do 1 rotation where it's a little bit of women's health and a little bit of peds. And then I would do my last rotation in whatever I really wanted, ER, urgent care. And then you have 40 hours max that you can do in a specialty. Okay, so you can do 40 hours in approved specialties. Approved specialties are outpatient clinics that specialize in something like a neurology, not neurosurgery, but a neurology clinic. Maybe you want to do an outpatient rotation in pulmonology. Maybe you want to do it in memory care. Maybe any approved specialty. You may not ever rotate though with a podiatrist or with a chiropractic provider, naturopathic medicine provider. it has to be with an MD, DO, or NP. The school is looking into possibly allowing PA preceptors in the future, but right now it is not approved. It's not, we don't have any regulation for PA preceptors. I'm going to take a quick pause to look at the chat. Okay. Yes, cardiology, as long as it's not interventional cardiology or inpatient cardiology is fine. If it's just an outpatient cardiology clinic, it would be approved for 40 hours as long as the preceptor is approved. So yes, absolutely, not even just 40 hours. The person, just so you know, we're not trying to be mean or horrible. It's because we're not insured, okay, for inpatient care. There's a different level of insurance for those areas. And don't forget that your instructors are family nurse practitioners. In some states, guys, FNPs aren't even allowed to do inpatient care. It just depends on the state. All right. So you can't expect your clinical instructors that USU hires to be able to supervise you in inpatient acute care. It's a very complicated issue. So students think we're being mean or we're just trying to say no to them all the time. That's not the case at all. We are trying to keep you out of trouble. We're trying to keep our instructors out of trouble. And we're definitely trying to keep our school accredited so that you can graduate with a degree from an accredited program. We don't want you to graduate from a program that is on notice or receiving issues that we have to look into because we find out that students are in areas where they're not supposed to be. So that's why we can only allow you in primary care, because that's what we're training you for. If you want to get a postmaster's certificate in acute care, adult acute care, or an ERNP, you sure can, but you just want to make sure you're careful. SNF, you need to be 40 hours only, and it really depends on I'm not sure about custodial care for SNF, but probably 40 hours. Home health for geriatrics. If it's primary care, it would be one rotation. Home health is wonderful, and I've done it myself as a career, as not a career, but as a job for a little bit. It's great, but the problem with home health as a student, you're really limited. You don't see a lot of a high volume of patients. On a very crammed and busy day, if I was doing real home health, going, not nursing home health is different, going from house to house, 8 is a lot in a day. It's hard to get to a lot because of driving. It depends on where you are and how organized your company is. So outpatient internal medicine. Yeah, outpatient internal medicine is excellent because you're getting a lot of diabetes, COPD, and a lot of really chronic stuff, CHF, a lot of those really complex cases, people who are both diabetic and have gout, or people who have like myasthenia gravis. As long as it's outpatient internal medicine, no problem. Psych mental health is considered a specialty. It is 40 hours. It's restricted to 40 hours. And urgent care and emergency room is not required at all for the program. Those are optional, okay? The 60 hours is strictly for ER. Urgent care doesn't have the 60 hours cap. It's only ER that has 60 hours cap. Urgent care has no cap, but you must meet the primary care full rotation. There is a really, nephrology is okay, but not dialysis. By the way, there is another really important one that I forgot to mention to you, 135 hours with an APRN. Notice I didn't say FNP, I said APRN. That could be an adult primary care nurse practitioner, could be a women's health nurse practitioner. You could have a mixed, you could have, let's say you did 40 hours with a women's health nurse practitioner. Let's say you did another 100 hours with a pediatric nurse practitioner. That's 140 hours. That meets your APRN criteria. So you have to have 135 hours with an APRN. You can't graduate from a family nurse practitioner school with having 0 time with a nurse practitioner. That makes no sense. And it's illegal from an accreditation standpoint. Accreditors say you have to have experience with an APRN. Some states, by the way, specify percentages. If you are from Oregon, listen up. If you're zoning out or if you're taking care of your kids, you have to have over 51% of your experiences with an APRN. More than half of your experience has to be with an APRN, less than half with an MD or DO. So there are specific state guidelines for some states. If you have a specific state guideline, your CPC should know. That's why it's super important to let them know if you move. Yeah, outpatient nephrology is fine. There's going to be a lot of one-offs here, and I'm not going to use the lecture time to answer all the one-offs because these are the very best resource if it's not in our catalog. And I can show you where our catalog it is, but I want you to look at the screen and look at what else you have to meet. So besides 135 hours in primary care, remember, urgent care does not count as primary care. You also have to do 100 entries. That means cases by the end of the program. Well, what does that mean? People wonder. People are like, well, does that mean 100 hours? No, it doesn't. It means 100 different patients. These patients should not be patients that you're just observing and shadowing. It's patients that you saw as the primary care provider and updated your preceptor on. So your own patients. So you have to see 100 Jerry. We count 65 and up as geriatrics. Or again, inpatient hours may not be counted, but if you want to go inpatient and follow and watch, you may, but you may not document those hours. It's considered your own time. It's not USU time if you follow your provider inpatient, but you may not count that at all. And don't even try, because we have had some students that were reported to the code of conduct for doing just that and got caught. So pediatrics, 80 journal entries by the end of the program. So 80 pediatric cases, but there's a breakdown because we don't want you to just see anyone under 18 and say, I'm a family nurse practitioner of never seeing a baby, right? No, you have to see a breakdown. So you guys are entering clinicals after March 2021. So your requirement is to get at least 15 infants ages 0 to 12 months. At least 50 children ages 1 to 12, and at least 15 adolescents, i.e. teens, age 13 to 17. We want you to get primary peds experience because primary care peds is much different than urgent care. If you see urgent care peds, you're going to see a lot of good stuff. But what you're not going to see is the supervision of the vaccine administration, watching the growth charts, making sure you know that when to do an audiogram, when to do a vision screening, when are you supposed to do lead and anemia screenings. You need to really know all of those guidelines and screenings, and you need to have exposure to primary care peds to do that. You need to have 40 journal entries. Journal entries means patients. So you need to see at least 40 women's health patients by the end of the program. What would be considered a women's health case? An annual women's health exam, pelvic exams, pap smears, breast exam, hormone replacement, birth control, pregnancy supervision, specifically visits pertaining solely to women's health and not other problems. What does not count as women's health is someone who happens to be a woman just going for something else. That should be pretty obvious, but some students try to stretch it when they're short on hours, or someone who happens to be pregnant. If they're there for a sore throat or they're there and they're pregnant and they needed a suture, that is not a women's health case just because they're pregnant, right? Unless it's a pregnancy supervision case or a pregnancy related or women's health case, it can't count as women's health. Here are where we get to our optional specialties, and they must be college approved. 40 hours maximum and 1 college approved specialty. You could also combine that and divide it up. So let's say you want to do 20 hours in cardiology and 20 hours in nephrology. That combined total is 40. You've maxed out. If you want to do a SNF, or if you want to do long-term care or memory care, you've maxed out your 40 hours. You can only do it for 40 hours. ED/ER, 60 hours maximum. But again, trauma is not acceptable. You may not rotate in trauma. Remember, it's not just about one person, it's about our whole organization. We don't train you for trauma in the curriculum. Our USU clinical instructors, i.e. people like me, are not board certified as ER or trauma, may not have ever stepped foot in a trauma center. So think about that. Think about some of your instructors. They are all, 100% of them are board certified NPs, your USU instructors, 100% board certified FNPs. Some of them just happen to have a dual certification. Some of them might have a dual certification in psych, some of them might have ER, but we don't know, and you're randomly assigned. And so you cannot rotate in trauma or inpatient because some of them have no experience and can't supervise you in those areas. Telehealth. maximum 135. And that's important to pay attention to. A lot of people really defaulted to telehealth during COVID. It's still going on. I think it's a good thing. Everyone thinks it's a good thing to have this opportunity for patients to remotely connect to providers. However, we do need to set limits. If you did all your hours in telehealth, you'll never know how to look into a patient's ear and diagnose an acute otitis media versus an effusion. If you didn't see patients in person, you might not be able to distinguish the subtle differences in their croup or their RSV sounds. You need to listen and look, and you need to have hands-on care. So you must have direct face-to-face care and only a total of 135 in telehealth. Now, that's not a minimum. You don't have to get 135 hours in telehealth. That's the maximum, okay? You may rotate in an urgent care setting, but you must meet all the required specialty requirements by the end of the program. So, you've got to have primary care Ps, you've got to have women's health. A lot of urgent care centers just don't take pregnant women. They don't take children under the age of 3. It just depends on the urgent care. So you will be really losing out if you only do an urgent care. Well, you can't, you have to have one, but if you mostly do an urgent care. In fact, my biggest advice to you is try your very best. It takes work, it takes effort, but try your best to network to get 4 different experiences. 3 would be good. I would never, ever want anyone to graduate with just one preceptor. Can it be done? Yes, because if you get a nurse practitioner who is in a full family practice primary care setting and sees everything from age 0 to age 100 and something, plus sees pregnant women, then technically you could graduate from one clinical site if it's a primary care program, right? Because if it's an NP, so it covers the NP requirement. If they see from birth to death, and then they'll get all the age groups. If they see pregnant women, you'll get that. It'll cover it all, but it's not good. This is your only time to get experience supervised and in a training and in a safe environment where you get feedback. I wouldn't want you to miss out on learning different styles and different approaches and different populations, right? You want to be exposed to a diverse level of cases. Can you imagine an MD graduating from med school saying, I only done one rotation in one place? You wouldn't have it, folks. And guys, are you held to those same standards as MDs? When you practice, are you held to lower standards because you've had less clinical time and less rotations? No, you are held to the same care standards as our MD counterparts. So if you ask me, do you think you should do 3 out of 4 rotations in urgent care because it's allowable? Yeah, it's allowable, but would I recommend it? Would I do it? No, because if it were me, and if you were my kid, you were my family, I would say get as much experience as you can with as many different providers as you can. Okay. So try to get different experiences. Is it easy? No. Do we have a preceptor shortage everywhere? Yeah. Is it going to be you calling people all the time? Is it going to be embarrassing to have to reach out and call in a favor or say, please, 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 so-and-so, can you consider me? Yeah, it's going to be a little awkward, but in the long run, you're looking out for you. You're looking out for your license. You're looking out for your future patients. Okay. So I know that was a lot. I'm going to stop share, and I'm going to check out the chat, see if I lost you. Hopefully I haven't lost you. Okay. Someone asked a great question in private. They asked, how do we get out of the issue of USU not having an affiliation agreement with whatever organization you're in? Well, it just depends. If they're a new clinical site, we get new affiliation agreements all the time. They take more time, so you need to make sure if you have someone that's new, you get that affiliation agreement going. It's actually pretty easy to get one going for a small private clinic. The problem we run into most is if it's a huge clinic in a city and they already partner with 2 or 3 universities, some of them, their hands are tied and they have exclusion clauses where they've actually promised that school not to work with any other schools. And it's not their fault. It's just that they, sometimes they're getting money, sometimes they're getting sometimes you're getting real estate, but sometimes you make deals with schools, especially big schools. So just check with your CPC, because again, if you don't have an affiliation agreement right now, it doesn't mean we can't. It really doesn't mean we can't. We could probably get that. I'm just going to also look at some of the appendices in this handbook because they're really useful. Okay, so I want to show you. I'm going to navigate to some other helpful areas. So I'm in the handbook and I'm going to appendices. Clinical health and safety requirements, student acknowledgement. You have to sign that before you start clinical, HIPAA confidentiality, CompLeo compliance, medical clearance. All of this is good, but the one I'm really wanting to get to is the site and preceptor guidance. This document talks about what are appropriate clinical sites for each of the courses. We haven't talked about this yet. There are 4 clinical courses. The first one is called Common Illnesses Across the Lifespan. We want you to be in a primary care family practice setting. We won't let you work in your 40-hour specialty during the very first clinical course. Okay, so just remember that. We won't let you work in a specialty in your first clinical course. You need to get your feet wet. So the focus is on primary care of the family. All right. In your second clinical course, it's called acute cares, acute illnesses across the lifespan. That would be more appropriate to get your urgent care. The third clinical course is called chronic illnesses across the lifespan. And that's your ideal time to be going to internal medicine or to be doing some geriatric rotations. Your final course is called clinical residency and practice management. You get 135 hours of whatever you haven't done yet. Unfortunately, a lot of students seem to tend to have trouble or put off getting a peds or women's health. A lot of people end up doing peds and women's health in the final semester, but it doesn't have to be like that. Let me show you some approved settings, approved for 40 hours max. Psych, pain management, diabetes, and again, these are all outpatient. Cancer center, nephrology, rheumatology, endocrinology, I don't know, neurology, cardiology, pulmonology, we wrote neuro twice, GI clinics, but no procedures. So no colonoscopies, no surgery. So then inappropriate, no acute care settings, never inpatient, no trauma units, no inpatient rehab, no substance abuse centers, no surgery centers, no PACU. You're not learning to be an FNP by doing a pre-op where you're just doing the checklist. No chiropractors, no acupuncture, no naturopathic preceptors, no med spa, cosmetic or aesthetics. I know you want to, but no Botox, no fillers and all of that, no lasers. Okay, that's not part of the family nurse practitioner role and not part of the board exam. It's not part of our curriculum. Okay, you have to do that on your own time, but can't be counted as hours. Infertility clinics, again, not allowed. Dialysis clinics, kidney centers, nope. Neurosurgery, not allowed. Neurology is. Sleep medicine, not allowed. COVID-19 testing centers. So if you have, there's a lot of COVID-19 testing centers, guys, and they're looking for students because they want to take advantage of you. They want free labor. Do you know how easy it is to do one of the screenings and to do a swab and to call someone back and explain the results? It's really easy. It doesn't involve a lot of critical thinking. It can, I don't want to poo-poo it because there are people with complex problems, but these COVID test pop-up clinics, you can't do rotations there as an FNP student, okay? You need to get real cases. You need to see people who need your help, who need health supervision and who are sick. All right, I'm gonna check the chat out. I lost an opportunity over there with Optum Care. They're unlocked with other schools. Hospice, 40 hours is allowed for hospice as long as it's not inpatient hospice in a hospital. If it's hospice at the home, it can be allowed for 40 hours. Any other questions? We went over a lot. I know a lot of you will have individual questions, but I'm really going to need you to follow our policy and look first at the clinical handbook. If it's not in the clinical handbook that we reviewed tonight, we didn't review the whole thing, by the way. It's like 100 pages. We went through maybe 10 of it, the most important ones. If we didn't answer your question tonight, talk to your CPC. How do I find my CPC? Well, if you don't know their name already, you can email ofe@usuniversity.edu. Be careful, investigate. And the other thing you can do, Aziz, is network with other students. You're new to California. You might not know preceptors yet because you're new, you were from Florida, but you can network on Facebook and the Facebook groups offline. You can network in your class. Anyone from California, you can network with people who are in the clinicals now and say, hey, when you're done, can I have your preceptor? Can you give me their contact information? and make sure they have 2-year, experience and all that. Someone asked me what would be the minimum experience for their NP preceptor. They wrote me a direct message, so I'm not going to, call out their name, but I don't know what's your requirement because you didn't tell me what state you were in. I don't know your specific board of nursing, and without, that I can't tell you, but everyone has a minimum of 135 minimum, everyone. Some states have more, but that's a minimum.
Thank
yeah.
you.
All right, I need to head off now. It's almost an hour into our lecture, but remember, look at the handbook. You have questions, go to your CPC. Your student advisor can help a little bit too. If it's about practice area or preceptors, CPC is the best bet. If it's about overall program requirements, your advisor can answer. If they can't answer, they'll shoot an email to myself